Hi, my name is Trinity Roberts. I'm a 20-year-old recently graduated student. Before doing dentistry, I was in the healthcare field for a little. I started off as being a dietary aide at a Zayland nursing home, and then I moved on to caregiving, which I am currently still doing at this moment. I am in the Air National Guard part time. I'm a person who just loves to help people. I love just making sure others are well taken care of. I just think that my positive attitude, my dependability, my honest, my truthfulness, my trustworthiness will bring a great aspect to your team. My great positive attitude will also bring a great aspect to your team. I think that can contribute very much. Can you describe your experience with dental radiography and safety protocols you follow? I have hands-on experience with dental radiography as part of dental assisting education and clinical practice. I work with both traditional film and digital film. I mainly use digital film, which includes taking common images like bite wings, periapicals, and panoramic radiographs. I am comfortable with preparing the room, positioning patients, and correctly setting the appropriate settings for good quality x-ray images. When it comes to safety protocols, I try to follow as low as reasonably achievable principles to minimize radiation exposure. This includes lead aprons for pregnant patients, positioning the equipment to avoid a lot of retakes, and using the lowest effective exposure time as possible. I also make sure to step out of the room and behind the wall when exposing the radiation. In addition, I do follow infection control protocols such as placing barriers, wearing gloves, and disinfecting between each patient. How do you manage the sanitizing and sterilization of equipment between patients? I try to stick to a very strict protocol when it comes with sanitizing and sterilization of using instruments or contaminated areas to minimize cross-contamination. I dispose of all single-use items first, such as saliva ejectors, gauze, and barriers. I carefully transport those other items to the sterilization area by using a tray with a lid over those items and the proper PPE. I wear gloves, masks, and eyewear through the process. For our reusable items, I make sure to wipe them down with a cavi wipe. I disinfect all contact surfaces and I place new barriers, and I perform proper hand hygiene between each patient, whether it's a sanitized rub or just washing my hands with an antimicrobial soap in general. What steps do you take when preparing for a patient's arrival and seating them in a chair? When preparing for a patient's arrival, I set up the room for what the procedure is going to be. I make sure I have the consent forms ready and finished for the patient to sign once back and seated in the operatory. I also review medical history, insurance info, and the reason for the visit and notes if necessary. I make sure that all PPE items such as suction tips and trays are ready. If x-ray is needed, I have that equipment set up as well. When the patients arrive, I greet them in a friendly and professional manner to help them feel more comfortable about being at the dentist. I verify that information in the treatment being performed today. When seated, I place a bib, hand them the shades for when the procedure is going to get started so they can put them on to protect their eyes. And I ask if they have any questions or concerns before we get started, anything that may bother them or they may be concerned about before we get started. I then let the doctor know that the patient is ready after everything has been covered on my end and treatment begins once the doctor arrives. What clinical skills are you the most confident in? I'm most confident in my infection control and sterilization procedures as well as chairside assistant. I'm very comfortable setting up and breaking down operatories, maintaining a clean and organized workspace, and following proper protocols to ensure patient safety. What experience do you have with dental practice management software, and what type of dental software have you used? I have experience with using dental practice management software during my training to schedule appointments, update patient records, scan items into the patient records, break appointments, document procedures, and review medical history. I have worked with Dentrix and Open Dental. I am comfortable navigating patient records and entering chart information. How do you handle patients, especially children, if they are nervous or scared about their procedure? For children, I use the do, show, tell method. So I show them, I do it on them, or pretend to do it on them, and I tell them what is going to happen. And then for younger adults and older adults, I kind of make small efforts such as giving them breaks in between, letting them know that they're doing great in between, updating them, maybe saying we're almost done with the procedure, you're doing great. And I usually try to ask them about their day and distract them from the other dental office things that may be going on around. What are your long-term goals in the dental field? My long-term goals in the dental field is to grow from being a dental assistant into a highly skilled orthodontist assistant and become a hygienist maybe. I want to continue building my chairside assisting skills, radiography skills, and patient care while strengthening my confidence and efficiency in a fast-paced dental setting. I eventually would like to further my education and expand more in dentistry. I eventually would like to further my education and expand more in the industry. My overall goal is to stay in the dental field long term and keep learning. Why did you choose dental assistant as a profession? I chose dental assistant because I always wanted to be hands-on in healthcare and do a job where I can work directly with patients and be a part of improving their oral health and self-esteem. I've always been interested in healthcare, being that I was once a patient who had low self-esteem due to my teeth not being how I wanted them to be, and I got orthodontic treatment, and now they are straight, and all I do is smile. So I've always been interested in healthcare, but I was especially drawn to dentistry because it combines clinical skills, patient interaction, and teamwork in a fast-paced environment. I also like that it allows me to make a real difference in a person's life. What are your greatest strengths and weaknesses? My greatest strengths is my attention to detail, my ability to stay organized, and my strong focus on patient care. In the industry, I've learned how important it is to be precise with infection control, radiographs, and chairside assisting. One area I am still working on is getting faster and confident in my clinical setting. I'm also working on being proactive and confident during procedures. Describe a time when you had to deal with a difficult patient or upset coworker. A difficult patient that I have had to probably deal with would be a patient that came in. She was from a nursing home, and then I went to bite down for x-rays, and it was really hard to get x-rays on the patient because of her being in a wheelchair, so it was very difficult to get those x-rays, especially a pen, because the patient wouldn't fully bite down, and when I let the doctor know, he stated that we had to have something in order to proceed, so it was kind of hard for me to get those x-rays, but I did somehow get those x-rays by talking that patient through the procedure and letting her know that she was doing a very great job. I just needed her to bite down a little more so I can get these x-rays. And describe a time. Do you have any questions for me as a potential employer? I don't have any questions for you as a potential employer. Thank you for your time.